Welcome to the Fiscal Physical Podcast. Join us each week as we sit down with the founder of Alchemy Wealth Management and author of Your Fiscal Physical, Ryan Nelson. Tune in to gain valuable insights and practical tips as we simplify complex financial concepts into digestible lessons. From budgeting to retirement planning, this podcast is your go-to resource for mastering financial literacy.
Welcome, everybody, to this week's episode of the Fiscal Physical Podcast. My name is Aaron. I am here with Ryan Nelson, as always, the founder of Alchemy Wealth Management, published author as well. Find Your Fiscal Physical, 7 Keys to Becoming Financially Fit. You can find that on Amazon. Ryan, how you doing today, my man?
I'm doing pretty darn well. How are you doing today?
You know, 2025 is treating me well so far, so excellent. At least at the time of recording this, so can't complain, man. Can't complain, you know. But with the switch over to the new year, as we are, you know, we're a few episodes deep into this now here. But you know, one of the topics I'm excited to cover today is the topic of health insurance. You know, people might be thinking, you know, hey, this is a financial podcast, which it is for the most part. But you know, when we're covering topics such as, you know, we've done like FSAs, flexible savings account, or spending accounts, health savings accounts, all these different ones. And so I think that, you know, I was perusing your book when I was looking to write this episode or outline this episode, and you talk about, you know, the importance of health insurance or, you know, medical expenses that can potentially, you know, derail someone's life almost. So I'm curious to see if you had, you know, maybe a bit more of a simplified breakdown of what health insurance is, how it works, why you might need it, why you might not need it, and just see what we can potentially share with the listeners.
Yeah, perfect. Let's do it.
Awesome.
So yeah, to preface, I'd say I am not an insurance professional. I actually use an insurance professional in purchasing my health insurance. So, you know, I obviously see value there and would encourage anybody who's looking or evaluating health insurance to talk with their insurance professional. So really, I don't know that this podcast would be on you know, a substitute for to talking to an insurance professional.
Yeah, we want to make sure that's clear. Yeah,
but let's talk about how health insurance could affect your long-term, say, retirement goals. Mm-hmm. And so, you know, taking a quick step back, how I like to think about this is, let's say we're planning for your retirement. You know, maybe we have a client who's putting away enough money. They're on track to retire at age 60. They're putting the right amount of money into the right accounts, and we've already figured out how to invest it, taking the right level of aggression and stuff. And so they're on track for, say, a retirement at age 60. So they're good to go, kind of had the green check mark. Now the question to me becomes, well, what wrenches could get thrown into that financial plan that would mess it up, right? So maybe needing to spend more in retirement than originally planned for, and through like the need for long-term care. Well, long-term care insurance could potentially cover that, right? Maybe becoming disabled prior to age 60 when you were planning on becoming retired. Maybe something like disability insurance could help address that potential risk, right? Passing away before you reach retirement. Maybe something like a small life insurance policy could cover that risk. And so another concern would be, what if you have this catastrophic event that creates a large financial burden on you from a healthcare perspective? So, you know, I think you were there actually when I cut my finger.
Yeah, I was there.
Yes. And so I had to go to the emergency room. You know, it was in the grand scheme of things a relatively small cut. You know, it cost me like $6,000 or something. That's a heavy penny. Now, you know, a pretty penny. Now imagine I had to stay there overnight. It was something more serious. I had to stay at the hospital overnight, or for 5 nights, or for a week, or 2 weeks, or had to get health, or what's it called? Emergiflight.
Yeah,
what's the helicopter?
Like a care flight.
Care flighted, or I get in an ambulance. You could imagine how that $6,000 turns into 60 into 600,000, right? And so if we had this awesome financial plan built out for somebody, maybe they're planning on retiring at age 60 with $2 million, and now all of a sudden they have a healthcare event that costs $500,000. That completely blows up their financial plan, right? And so the value of health insurance is really protecting against that potential risk, right? So once we have this financial plan all dialed in, what risks could kind of pop up? a big healthcare event could. Health insurance is what's going to protect you against that, right? So you pay, a premium on a monthly basis, and then most health insurance, you're going to have some level of deductible. So maybe you're only out of pocket, whatever, $10,000. So you have this $500,000 event. You're on the hook for 10 grand of it. Mm-hmm. Health insurance is paying the rest. And now you can still stay on track with your financial goals, and still retire at age 60, right? So largely, I think high level, that's the value of health insurance. And there's like this asymmetric risk. The cost of health insurance is not that much, but the cost of not having health insurance is probably nothing. But if that one-off event happens and happens to happen to you, it could put you in a very, very bad spot. There's some people who really never recover financially from their medical debt, unfortunately.
Oh yeah, man. It's one of those things where I'm happy that I have health insurance and such too. But my wife, over the last couple of years, had to have a couple of surgeries, and we just how insurance works in general. We just get sent the original bill a lot of times. Right. So you get that, and you're like, wow, this was like a 2-hour surgery, or she spent a night in the hospital, and you're looking at this bill that comes before insurance gets it, and it can be hundreds of thousands of dollars.
Oh yeah, it's crazy.
It is insane, the amount, and you're like, oh my gosh, like this would, if I didn't have my health insurance, this would ruin my life. I mean, we pay like a $300 deductible, and then it's all good like after that or whatever. So we have pretty good health insurance, but it still is just terrifying to think about, like what would, like you said, like that would just completely change your life almost.
Right. So if you didn't have this awesome health insurance through work, you had to go buy it on your own, man, it might suck to pay $500 a person for health insurance, but in that event, you would have been glad that you were paying the $6,000 a year to have that protection, right?
Oh, definitely.
So yeah, there's definitely some value there. I think that the health insurance itself is this extremely complicated, like convoluted system that very few people, including myself, do not understand. And I will say, if that's something that interests you, I did listen to another podcast here recently. I know I've talked about him before, but Dr. Peter Attia, he has a podcast called The Drive. This is episode number 327 for him. So again, the name of the podcast is The Drive. It's by Peter Attia, and it's episode number 327. And it's all about healthcare and how it actually works. And it gives you a pretty good, it kind of walks you through the system, because and how the actual billing works. And if anything, you'll probably leave that conversation more convinced that you need health insurance. But if you were here hoping to get some more of the sort of tangible details around how actual health insurance works, I'd say that'd be a great resource for you.
That's awesome. I'm going to listen to that later for sure.
Yeah, it's a good one.
Yeah.
The other thing I think is interesting. So I tried to do a little bit of research here. So these numbers, again, a lot of these numbers we look up, you could look up 5 different resources and find 5 different numbers, right?
Definitely. Yep.
So I don't care so much about what the exact number is, but it helps give us at least an order of magnitude. So this says that the average person spends about $320,000 per person for healthcare throughout your life.
Oh wow!
So about a third of $1,000,000. So the alternative to not having health insurance, if you think about it, if you're an average person, it means you need to have maybe an emergency savings account of $320,000 that you just pay, your insurance, your healthcare needs over the years. So that'd be something to just kind of think about. And again, that's average. So there's some people, that maybe just pass away silently and don't need a ton of healthcare.
Sure.
And there's other people who, will live into their 90s and fighting numerous cancers and, spend millions of dollars, right? So think of that, $320,000 for the average individual. The other thing that I think is interesting, and I tried to find data on this too, I've heard different numbers, but it just varies so drastically. It's hard to find good numbers on this. But when these healthcare costs come, and so in general, most of your healthcare costs come at the very beginning of your life, so through your pregnancy and infancy, and then at the end of your life. So anybody listening to this podcast, I'm assuming, is not an infant. So while there were some healthcare expenses probably already in your life at the beginning, those are already gone. That's water under the bridge. We can't plan for that, right?
Right, yeah. It'd be great if they could pay it.
So looking forward, as an adult who's saving for retirement, looking forward, for most of us, the majority of our healthcare expenses are going to fall towards the end of life, and pretty substantially so. But one thing that I always think is interesting from like a retirement planning standpoint is like, what is the cost? So of course, health insurance, you pay your X number of dollars per month. Mm-hmm. You get access to the health insurance. That's awesome in itself. It protects you. You have these surgeries that cost you hundreds of thousands of dollars. Perfect. You're protected. You're only paying your deductible. Outside of that, so that's a great financial decision. What I also think is like an interesting sort of outside of the box, like just what is the financial benefit to like daily exercise?
Right. Sure.
Right.
Oh yeah.
Like if you exercise, 6 days a week, most of us just think of that as, oh, you're going to be, maybe lose some fat, gain some muscle, right? Maybe be a little healthier, look better. But there's actually probably a financial repercussion to that, right? Mm-hmm. You're probably going to need less healthcare costs, or at least delay those healthcare costs, right? So if we think about, hey, the average person is going to spend the majority of their healthcare costs towards the end of their life, think about, we had an episode earlier about the rule of 72, right? You remember that one? So the rule...
I do remember the rule of 72. Yes, sorry, my microphone was off there.
Yeah, no
great
worries.
job.
So the rule of 72, give you a quick quiz here. If you got 7.2% annual returns, how long would it take for your portfolio to double?
12 years.
10 years.
10 years. Okay.
Yep. So 7.2 times 10 is 72.
Oh, gotcha. Because
yep.
Compound.
Yep. So if you had, if you were getting say 7.2% returns, your portfolio would double every 10 years. So imagine, if you're in retirement, whatever, and you're able to push out your healthcare costs by 10 years just from doing exercise, maintaining a healthier life. That means your net worth would have, in theory, doubled over that 10 years or whatever you have set aside for healthcare costs, right? Your money would have doubled over that 10 years, and you'd be a little more prepared probably to pay those health needs, right? So just something to think about as well. Outside of health insurance, if you're planning for your financial freedom, right? There's more that comes into it than just like dollars and cents and getting the right dollars in the right accounts. Like, and I'd say taking care of your body is probably, on the topic of health insurance, is probably one of those things that, can substantially help your financial situation.
Yeah, no, that's a very interesting way of putting it, and I think very enlightening as well, because you do. Sometimes I do get caught up in like the dollars and cents in the accounts.
It's easy.
And like it's just what you think about finances, and you're like, oh, okay, cool. Where's my spreadsheet? Where are these different things? But to think about like, oh, the impact that your health has to have on those finances. One, maybe you're not going to be able to spend that money if you don't make it to that 60 or whatever your retirement age. So that's one piece of it, and then also being, if you're able to put off these, huge health issues that you might have because you're just exercising, 30 minutes a day. Mm-hmm. You look back and you're like, well, that saved me, $300,000 over my life. Like, that's a pretty good trade-off for 30 minutes of exercise per day too. So that's a great way to tie it kind of all into like what encompasses like financial freedom, financial health is also health in there too.
Yeah,
so
absolutely. Yeah. So now we're tying in the physical part into the physical.
I was hoping it would come up at some point here. Yeah. But that's awesome, right? No, I think that's a great way to kind of break that down. And once again, we're not or health insurance professionals or anything like that, but I think that it's important to realize that your health and what you spend on your health impacts your financial future as well too, and your financial well-being. So
absolutely.
Excellent. Well, we'll go ahead and take a quick pause here. We'll be right back on the other side of this. Everyone hang tight.
And now, to put the personal in personal finance.
Thanks so much for coming back with us here, everybody. We're on this the personal side of the Fiscal Physical podcast. I'm here with Ryan Nelson still, and Ryan, we're going to do a just a question I had for you here, as you being a financial advisor, and I don't know if you have an answer to this, but we'll find out. But what's the best financial advice you've ever received, and who gave it to you?
Yeah, I don't know that I do have a great answer for that. There's no just one piece of advice that stands out in my mind. I think, more so I learned probably from actions and example, and, my parents lived within their means, which helped set a good example for me. So that was probably my biggest takeaway, or what's helped set me up for the most financial success. It wasn't any single piece of advice provided to me. It was just the way they lived their life for decades, right? So that's probably been my biggest takeaway. And similarly, like I don't necessarily think there's probably anything I could say like just like right now that somebody else could take from this podcast and like change their life. But I do think changing, like tuning into the podcast every single week starts to change your identity, and you start to hear things and themes, and you have these consistent takeaways that again change your identity. And over a year's time of listening to a podcast every single week, it changes the way how you think about the world and what's top of mind. And I think that definitely does affect. So I'd say, yeah, I mean, I don't know that I necessarily either have any advice either. It'd just be more so like incorporating like steady reminders into your day. What about you? What advice have you received?
Great way to put it. I think that, the advice I always feel like comes and goes. Like you'll hear everyone's given advice in the world. That's just what it is. Like here it is. Like this is what you should do, and it can get a little bit overwhelming. I mean, I think there's two things that. One, obviously, the advice of stay the course. Naturally,
of course, you got to.
I've got that tattooed on myself. But I think you hit on the other one that I was going to say is do your best to live within your means. I think that's the biggest thing that like I still struggle with sometimes is like I'm 34 and I'm like, cool, like we have this like money, should we do something, should we incorporate more debt or more bills that we have to come up,
right?
But it's super great, like this is a great like piece, like increases like our quality of life potentially, but you have to kind of take a step back and think, okay, is this actually a good financial decision in the long run? But is this within our means of where we want to live our life? Are we getting into a place where we're now going to have more money in order to sustain that lifestyle? Like, so I think the living within your means is a great piece of advice. A little harder to follow than I'd like it to be sometimes.
Right. Oh, super hard.
But I sometimes look back at my monthly statement. I'm like, whoa, all right, I'll get them next month. And then suddenly we're into February, and I'm like, all right, I'll get them next year. Right. So, but I think that's a good way to put it is as best you can live within your financial means, and just be aware of the consequences that you're going to have if you do extend outside of your means too. So everyone can take that for what they want, but I'd really hammer home on stay the course though. That's the one.
Yeah, I like it. Stay the course.
Exactly. Yeah, we'll have to add that in some here. But, awesome. Well, thanks everybody. Really appreciate you guys tuning into this episode here, checking us out. Couldn't do it without you guys. Well, we could. It'd just be a lot boring, I guess. But thanks everybody who's checking us out on Spotify, Apple Podcasts, wherever you get your podcasts. And Ryan, any final thoughts?
Well, as always, stay the course.
Thank you for joining us for the Fiscal Physical Podcast. Until next time, happy listening. And as always, stay the course. If you have a question or topic suggestions, please email us at podcast@alchemywealth.com. If you enjoyed today's discussion, subscribe to the podcast to ensure you never miss an episode. And consider leaving us a rating and review on your favorite platform. This helps other listeners like you find the show. For more resources, you can visit Alchemy Wealth Management's website at www.alchemywealth.com or find your Fiscal Physical, the book, on Amazon. We'd be remiss if we didn't mention that personal finance is just that, personal. Please don't take anything we say as advice. The preceding content is for informational and entertainment purposes only. It's not an offer or a solicitation, nor should it be construed or relied upon for tax, legal, or investment advice. It doesn't consider your personal financial situation or objectives and may not be suitable for you.